Today is an interview I've really been looking forward to. Uh, our guest is doing something important in the area of healthcare. And whatever you're doing today, I hope you stop and listen in because this is an important and necessary change. Obviously, it's personal to me from my experience with 3 months in the hospitals and all that. I've witnessed some of the brokenness firsthand, and I've looked at the stack of bills, literally 2-inch stack of bills sitting on my desk. And Josh Butler he comes from a family of entrepreneurs. His family goes back deep in the history of Texas. His great great grandfather was a rancher. His family got in the oil business. He's about as Texan as they come. And one of the things I think that means is finding new and better ways to doing things and doing them without letting people stop you. And one of the quotes he gave me, he said, the greatest leader is not necessarily the one who does the greatest things. He's the one that gets people to do the greatest things. And this is a Herculean task to make these changes. And so I hope you'll become part of this change. And so I want to introduce Josh Butler. He's owner of Butler Benefits and runs the High Plains Health Plan. That's health plan that covers northern Texas, a little bit of New Mexico, and maybe Oklahoma. But Josh, welcome.
Hey, Craig, thanks so much. Thanks for having me.
So, we've talked before, and most of what we talked about was was what you're doing in healthcare. What you didn't tell me at that time was you met David Lee Roth.
I did. I met David Lee Roth once upon a time. I did.
And so for the few people that don't know who David Lee Roth is, he was the original lead singer of Van Halen. And where'd you meet David Lee Roth?
Well, Craig, I guess we're just going to get right out of the gate and get into my skeletons in my closet. Not a whole lot of people that I'm associated with today, Craig, know my checkered past, I would say. Before I got into insurance and employee benefits and consulting, I worked for a country and western nightclub chain. They own country and western nightclubs all across the United States. And I
So,
actually,
so wait a minute. Wait, are you telling me that David Lee Roth is a closet country star? when, when he's not
no,
sporting the long hair and the tight leathers, he's playing country?
no, he was not playing country, and he was very much in his spandex and his long hair when we met. We met in Amarillo. We had a country and western nightclub here. It was a rather large venue. And people that live around here know exactly the venue that I'm talking about. But we did a cross promotional deal with a local rock station, Rock 108, and they had gotten into inviting artists to stop through Amarillo. Maybe they were passing from Dallas to Denver, on their tour bus, and we're able to get these folks to stop in Amarillo and play shows in smaller venues. And this was at the tail end of, this is not at the heyday of Van Halen. Obviously, I'm not quite that old. Um, but yeah, David Lee Roth was one of the artists that stopped in Amarillo and played a show at the country and western nightclub that I was the general manager for. So uh, interesting guy.
I gotta say, I mean, I used to listen to, I had a lot of Van Halen albums. I listened to a lot of Van Halen. Never before have I heard that David Lee Roth played in a country and western bar.
He certainly did.
Wow. And so you, so that's where you got your start. That's where you learned business.
So it's where I learned a lot of business. As a lot of young people that, back when college was actually affordable, I didn't have the luxury of being on any type of scholarship to go to school. And my family did help, pay for a little bit of my college, but a lot of it, fell on me for the financial responsibility. So I had to work, like a lot of college people do have to do today. And so I took a job at this country and western nightclub as a bartender, and ultimately I kept working there because I was able to work 3 nights a week and pay my rent and make my truck payment and buy groceries and keep up with my living expenses and have a little bit of playing around money. But then as I got closer to graduating college, I went to my boss and I just said, "Hey, man, I guess I got to get out in the real world and get a real job." And that's when they made me an offer and they said, "Hey, look, we think that you're a smart guy and you're definitely a hard worker, and we'd like to offer you a management position." And so I didn't have a whole lot going on, Craig. I mean, it's not like I was going to Goldman Sachs, right? So I took it and went down south to San Antonio for a spell. Then I was in Houston for a little while, and then I just continued to graduate up and get promoted up through hard work and effort and things, and up until I became an operations manager and managed a couple of hundred employees, and the rest is history. And Craig, that is way in the rearview mirror.
Wow. Well, so how did you go from that to insurance?
Yeah, so I mean, as you can imagine, I mean, the lifestyle. I was a single guy at the time. Not nightclub life is not very conducive to family life. And as I had worked for that organization for a number of years and kind of climbed their corporate ladder, I wanted to go do different things. And I had a friend who introduced me to a guy that was working in insurance. And I'm a salesperson, like you mentioned. I come from a long line of entrepreneurs. I loved the idea of being in sales because there was no cap on your income potential, right? And so I jumped ship. I left the country and western nightclub industry, got into insurance sales, and I've been in it ever since. And then in 2015, my wife and I started our own consulting and brokerage firm. That's Butler Benefits and Consulting that you referenced off the top. And we've been blessed and we've been successful. And then in 2022, we launched High Plains Health Plan.
Okay.
There it is at a 50,000-foot level.
So, and just so people know where we're going, High Plains Healthcare, it's a healthcare plan where it's for companies, it's group plans, and it's for the employees pay $0 deductibles. If they need to go to the doctor, they go to the doctor.
So we do offer a very unique plan that does provide $0 deductibles and $0 copays for thousands of medical services and procedures, including all generic medication is covered at 100%. It's a $0 copay for generic meds as well. And so, yes, sir, that is the type of health plan that we have, that we've constructed and built, and it is gaining traction. Hopefully this will help promote that as well.
Well, and so you launched High Plains Health Plan in 2022. What was happening there? What was the impetus? What got that started? What was different from Butler Benefits?
Yeah, so Butler Benefits is more of a traditional brokerage firm. We're an independent brokerage firm, so that means that we can sell insurance plans for companies like Blue Cross Blue Shield, Cigna, Aetna, Humana, United Healthcare, Guardian, Aflac, Colonial, you name it. I mean, we're appointed with a lot of different insurance companies, but healthcare and health insurance are two different things. And so what we started to see predominantly more and more of is health insurance has gotten so damn expensive because healthcare is expensive. And if we're going to try to get control of health insurance costs, we have to address health care costs directly and specifically. And so that's what we started to do. We just first it started with a question and a thought of, is it even possible to pay less for healthcare? And if it is, let's go figure out how to do that. And then, just things start to evolve and things start to come together. And we realized that we had access to all these solutions, whether we developed them internally or we collaborated with a different organization or what we call a point solution vendor partner. That's what the work they were doing. We discovered this entire community of companies and organizations around the country that had the same mission, had the same purpose, is to lower the cost of healthcare and make it more accessible and more affordable for more people. But what we kept running into was, how does all of this work within a Blue Cross Blue Shield plan? And I don't mean to pick on Blue Cross Blue Shield, or because it's not them specifically, but these types of solutions don't work in a traditional insurance environment. And there's a whole host of reasons why that we could do 5 more podcast episodes and cover them all, and you still wouldn't cover them all. But we decided we're not going to be able to get the results that companies and employees are looking for, because they all want the same thing, Craig, which is what? To lower their costs without compromising the integrity and the quality of their benefits. If I put a $50,000 deductible in place, yeah, it might lower your premium, but nobody can afford to use the plan, right? So it defeats the purpose. And so we decided the only way that we feel like, or one of the most effective ways you can accomplish that, is to build your own health plan. And we did that. And it's still a labor. It is a lot of hard work, but we launched it in 2022. We've got about 18 months of experience under our belts, and the plans are performing exceptionally well. And we knew that they would, because of the concepts and the strategies that were in place to drive down the cost of healthcare.
So when I hear $0 deductible, I think expensive. I think the higher the deductible, the cheaper it is, the lower the deductible, the more expensive it is.
For sure. I mean, I'm happy to address that but let me back up for just a second
Yeah.
and predicate my answer on this. And you're going to shake your head and you're going to say, you know what, you're right. Is if you think about all the things that we purchase in the American economy, I can only think of one thing that we all consume and we all purchase before you ever know a price and before you ever know the quality of what you're buying. And it's called healthcare. Okay. Yeah. So, and then another thing is health insurance, and the way insurance plans are designed. I'll give this example. If you have a $5,000 deductible and maximum out of pocket, you really don't care what the total price tag is of your service. All you really care about, Craig, is what comes out of your pocket and what your personal financial liability is for that service, which is only $5,000. People have lost sight of that they don't care what the ultimate sticker price is. But I use this analogy all the time. Craig, what is this?
It's a mobile phone.
Would you give me $25,000 for this phone?
No, absolutely not.
Why not?
Because I can buy a pretty good one for $1,000.
How do you know that?
Prices are listed.
They're not listed in healthcare now, are they, Craig? So now you're getting down to why people don't know the price of what they're buying. And just on principle, I don't care. Do you think Warren Buffett would buy this cell phone from me for $25,000?
What I know about Warren Buffett, if it's $1,000 phone, he's going to figure out how to buy it for $500.
Thank you very much. And so that begs the thing. It's not about if we have the resources to buy something at a certain price. Out of principle alone, Warren Buffett would not pay me $25,000 for this piece of technology. And so that's the thing. And that's why you're seeing all these legislative laws and things get done at the legislative level in states and even at the federal level to give people like me and like you access and transparency into first pricing. And we use that kind of data to go negotiate better prices for our clients. So if under another agreement somewhere, a knee surgery used to cost 50 grand, and I go negotiate it for 20 grand, and that's a real example, by the way, that's not a hyperbolic situation. That is a real situation that's very, very common. I just generated $30,000 worth of savings through that negotiation. Well, if I can save $30,000 on a surgery, Craig, I can well afford to cover your $5,000 deductible and out of pocket and still net save $25,000 on the procedure. Everybody wins. But you have to have a mechanism where all of that is easy enough for the patient that when they walk in somewhere, all they got to do is hand them that ID card and they got insurance and everything gets set in motion to accomplish that.
Now, one thing that I think is a mystery, in addition to how things are priced, I think one thing that's a mystery to people is how Blue Cross Blue Shield, gets billed by, let's say a hospital. And if I understand it correctly, it's a multiple of Medicare.
A lot of newer contracts and updated contracts can be a multiple of Medicare, but some of the old legacy contracts can even be a discount off billed charges. So that's typically why you see a hospital bill and people think, oh my gosh, look at this bill. They charged $58 for a single tablet of Tylenol. Well, yes, they charged $58, but nobody got paid $58, right? None of the payers, none of the insurance companies actually pay those list billed charges. It's some discount off of that. So there's two different methodologies that you just brought up, though. There is a discount off of a list price, or there is a markup over a Medicare allowable. And we think that the latter, the markup over what Medicare allows for services, is more in line with what we would deem a fair price than a discount off of a $58 charge for a single tablet of aspirin. Because most insurance discounts, Craig, are in the neighborhood of between 50 and 60%. So let me ask the final question. If I gave you a 50% discount on a single tablet of aspirin or Tylenol priced at $58, are you getting a good deal or a bad deal?
Yeah. Yeah, exactly. I mean,
And that's what happens in healthcare thousands and thousands and thousands of times every minute in this country. And that's how healthcare is bought and paid for. And people don't understand it. People don't even know it. And they wonder and they sit around and they ask questions like, why is my health insurance so expensive? Why are my premiums keep going up year over year over year? Now you know.
well, let me give a couple examples from my journey of things that have consumed a lot of my time. And I'm the outlier. I'm a little bit of I'm a little bit of a bulldog on some things, and one was a case of fraud. And just for the lawyers that are listening, uh, this is alleged fraud. The company that committed it has admitted nothing, but I will tell you, there's a company out there called Rotech Healthcare that supplies oxygen. And in 2018, they paid the DOJ $10 million for knowingly defrauding Medicare patients. That is a factual statement in the public record. But anyway, I had a company that was claimed to be providing me oxygen, and they billed me and my insurance company for oxygen for 2 years. And it first started when I was in the hospital in the ICU on the ventilator, and all they provided was portable oxygen. So obviously I wasn't using portable oxygen when I was on the ventilator. So that's when it started. And they continuously billed me for a year and 3 months after I returned the oxygen to the company that was actually providing me the oxygen. And so my insurance company got billed, and they actually paid out benefits to two different oxygen suppliers overlapping the same time.
Mm-hmm.
And I ended up having to spend $1,500 to get a lawyer to make all this go away because they were threatening me with payment.
Yeah, collections. Yep.
And but when I look at that, that's an example of an inefficiency. My insurance company paid them a lot of money for oxygen they never delivered.
Correct. And a common question gets asked: why would an insurance company not catch that? And there's a lot of stories and reports, and there's a lot of investigative journalists that have done this work. And there's no, I mean, when it's not their money that they're paying the vast majority of insurance claims with, and I'll get back to that in just a second. Where's the incentive to catch this fraud? Where's the incentive to catch these billing errors? Where's the incentive to lower the price of healthcare? There's a whole lot of, misaligned incentives in healthcare that are counterintuitive to most people. Most people think the insurance company wants to absolutely pay the very least amount they have to pay. Not necessarily. Not necessarily. And there's a whole provision in the Affordable Care Act that kind of set that in motion way back in 2012. It's called the medical loss ratio of the Affordable Care Act. Again, a whole nother episode of your podcast. But the thing is that it's counterintuitive to people, is that it's like taxes. When we try to say that the government, they first must extract money from the citizens through taxes before anything ever gets paid. Before any road gets built, before anything that gets bought and paid for gets bought and paid for, they first must extract from the electorate, from the citizens of this country who pay taxes in order to make those payments. Insurance companies are the same way. They first must extract funds from fully insured employers through the form of premiums before they can ever pay a claim. So if you want to know why your premium is sky high, it's because they're given a 50% discount on a $58 tablet of aspirin. You're getting ripped off. Everybody says, oh, look how great of a discount we offer. But nobody ever stops to ask, a discount off what? A discount off of $58 for a single Tylenol is still a bad deal. And so that's why we have in our industry, a lot of people use this, this comment and this quote, and it goes back to this phone. I'll give you a 99% discount on this phone, Craig, under one condition. As long as I get to set the price, I'll give you any kind of discount. And that's what we have historically seen in healthcare is the prices are inflated 400, 500, 800, 1,000, 1,300, 1,700, 2,000%. And then they turn around and offer you a 50 to 60% discount. And so the thing is, more and more people need to understand the finance mechanisms of healthcare and how healthcare actually gets paid for is what's messed up in this country.
Yeah, unfortunately, it's been an expensive lesson for me, and it's been a painful lesson.
Yeah.
Watching it. I mean, if and to your point, my hospital stay came in somewhere around the $2 million billed. And you told me before, you said the insurance company paid nowhere near that.
No. They might have paid $1 million though on a $2 million bill. I mean, if you just look at the statistical average discounts through PPO networks, I don't know if you're on a PPO plan or an HMO plan, but let's say it was a PPO network plan. And let's say it was with United Healthcare. It doesn't matter. You can pick. They're all going to be in the same similar vicinity as one another on a $2 million bill. What if they got a 50% discount? That's still $1 million in care. But was that still egregiously overpriced at the end of the day? I mean, that's the type of analysis that we do for companies. And we say, yeah, you got a 50% discount on $2 million, but under deals that we negotiate, you would have gotten a 76% discount. And so that's how we're driving down the unit cost of care for services, hospital stays, prescription drugs, diagnostic imaging, things like MRIs, CT scans, sonograms, PET scans, hip replacements, you name it. I mean, all kinds of things that we're able to impact the unit price of and what the plans actually have to pay out in the form of a claim. And when you lower that, then naturally health insurance premiums are going to come down with it. And that's our belief. That's what we're setting out to prove in this country, is that there are solutions in this realm, and we don't need a government to swoop in and take it over. We just don't.
I used to say, I used to tell people, I said, we have the best healthcare in the world. I've lived in multiple first world nations and I've experienced healthcare abroad. And I was like, what we have is better. And I got to say, after my experience going through the hospital, I don't say that anymore. But the one thing I say is where I've experienced government run healthcare, what I experienced, I don't want that. I don't want that. But I'm also not defending what we have, because what we have seems really, really broken.
Well, especially, when COVID-19 came around, and I know that I don't know anybody that it was as severe. I know I had some friends and some people that we knew that passed away from COVID-19, but you obviously had a very, very severe case. I had a severe case, but nothing like you. I had double pneumonia as well. I was down for about 40 days, nowhere near 3 months. But I can tell you, I think that COVID really kind of exposed our healthcare system on not being prepared for those types of pandemic situations. And it really kind of exposed the quality issues that are existent in our healthcare system. Now, I do not have a clinical background. I'm not a physician. I'm not a nurse. I'm not, a pharmacist or anything like that. But I work with a lot of those types of people, and so they express the same concerns that you just shared. Is that, where are we buying our ingredients for our prescription drugs? how are we reliant on countries that don't like us very much, and that it's all tied to our healthcare system right now. I mean, the SEC allowed a merger to happen between the largest insurance company in the world, United Health Group, and one of their subsidiary companies, Optum. They bought another company, and they allowed that merger to happen. Well, this other company is a switch operator for tens of thousands of pharmacies, and they just got hacked last week. I don't know if you saw that story,
I did not.
but it affects, and then they just completely shut down their systems. And now this is affecting over 70,000 pharmacies from coast to coast, that these pharmacies and these doctors are not able to submit their claims and get their payments because of this consolidation. And that's one of the fears, and why the SEC gets involved on mergers and acquisitions is like, if you allow these two major companies to form into one, and that one company gets a cyber attack like what just happened in the last 2 weeks with Change Healthcare, it can disrupt the entire healthcare system. And that's another risk and another direction I see our healthcare industry going, that I think poses a real threat and a real danger to the safety and security of not just our country, but and companies, but of all citizens. When you can basically shut down our claims processing companies, and people can't get paid and people can't get prescriptions filled, that's a major, major disruption. And I'm pretty fearful. I don't trust the government to guide us in the right direction in almost any facet of what we're doing in healthcare.
No. Well, let me bring up another situation from my journey, because I think you may have something to say about this as well. So, what I've discovered is, when you get the service, let's say, and I'll use an example, an anesthesiologist, because I had a few of those. Right after they deliver the services, they deliver a bill. And, most companies will continue to bill on a monthly basis until you pay your bill. Well, I found in healthcare, they quit billing, they go silent, and then the next thing you see is you're in collections. That's the next notice, is you're in collections like a year later. Well, on September 11th, 2021, I was in surgery having a trach put in. And obviously, when you're in surgery, there's an anesthesiologist there. And they put out a bill for $2,400 for that. But they never submitted it to insurance. And, most likely if they'd submitted to insurance, insurance would have knocked it down to about $1,000, but insurance would have paid 100% of that, because it was, I'd already met my deductible. Well, they never submitted it. And then one point last year, I get this notice from a law firm that's trying to collect debt, actually a law firm up in North Texas, up in Sherman, and trying to collect debt on that. And I wrote back to them and I said, hey, you guys never filed this with insurance.
Mm-hmm.
Go back and file it with insurance. And turns out, I found out they missed the deadline.
Timely filing.
So anyway, there's this anesthesiologist out there that should have been paid. I mean, his job was keep me alive during surgery. I'm still alive. He should have gotten paid, but he never got paid. And because he doesn't get paid, part of his business model says, I'm going to charge more for all these services to cover, what I know will be a certain amount of loss. How does what you're doing address unclaimed bills or unpaid bills?
Well, there's a couple of things. I think that the No Surprises Act, NSA, has addressed this particular issue with using an in-network facility. I'm assuming the hospital you were in and you received this trach and this procedure was an in-network hospital.
Yeah.
Okay. So now No Surprises Act has some consumer protections built into it, that if you're at an in-network facility, but you receive services from an out-of-network provider like this anesthesiologist, because many anesthesiology groups are not in network with anybody. And so if they were, then they are contractually obligated to submit that claim in a timely manner to the insurance company for adjudication, processing, and payment of that claim. So I'm not saying this is what happened in your case, but I have seen this in other cases that I've got involved with, is that that anesthesia company knows if I submit this over to insurance, this bill is going to be discounted. Let's stay with the same percentage we've been using on the other stories, 50%. $2,000 bill, I'm going to get paid $1,000. But is there a chance that if I send Craig Andrews a $2,000 bill and keep hounding him to pay the full 2,000, that he'll just pay me out of his pocket, assuming that he owes it? Because I think that most people, when they receive a bill, to your point a second ago, they provided the service, they deserve to get paid. Well, when I get a bill for $2,000, I guess I owe it. If that's the bill, I guess I got to pay it. And that is a very understandable perception and understanding that because like if you get the electric bill, you know you owe it, right? And you're assuming that the electric company has done an accurate job of reading your meter and assessing you the right rates and charging you the right rates. And you don't even think to question the bill, you just pay it. Like most Americans that give bills, we pay them. So that's the hope, is that I don't want to get paid $1,000 if Craig will pay me 2,000. So just send him the bill and don't send it to insurance. And then if they don't send it to insurance, we'll send him to collections and we'll see what we can get out of it. Now, I wouldn't say a lot, but I have seen out of network provider groups behave in this way. And this is why educating the public through things like podcasts and things like open enrollment meetings and town hall meetings. This is why these venues are so important and these discussions are important, is because people need to understand what types of protections they have under the law, what types of protections they have under their insurance contracts. Because when you purchase an insurance policy, you are entering into a contract. And if those providers of care are also in the network, they are in a contractual relationship with yourself, with all the doc and everybody else that are in the network. And so just people, this is not their area of expertise. But now there are some protections built in for things like NSA. But we advise people a lot of times we will reach it directly out to those out of network providers and say, hey, listen, you're out of network and here's what the plan provision is. Craig's already met his deductible. And if you submit your claim over to us, here's what we're going to pay you. And if they're out of network, they can balance bill. They can send you a bill for the balance. But oftentimes we're very successful at getting those balance bills to go away because there's more legal protections coming through things like independent dispute resolution, where you say, that's not a reasonable amount. I'm not paying you $2,000. My insurance company paid you $1,000, and that is deemed reasonable and customary. Leave me alone. And we're pretty successful in that arena. And there's other companies out there that do similar work. But yeah, we get involved with our clients and we roll up our sleeves. We're advocates and we try to help people avoid those types of situations.
Yeah.
But for time, let me finish it up with this. Timely filing. I think it is a reasonable expectation. If someone came to your house to mow your yard, okay, I use the lawn care analogy quite a bit. If someone came to your yard or house to mow your yard, you would expect to get a bill, correct? If they say, hey, here's my process, I'm going to bill you later, Craig, I'm going to bill you later, right? And somebody came back to you 2 years down the road and said, hey, man, I just turned you over to collections because you never paid me for mowing my yard. And you're like, well, you didn't send me a bill. And, you wouldn't pay the bill. I mean, you might, because you actually think, well, if the price was fair. But what if the guy sent you a bill for $5,000 and he's like, oh, well, I forgot to send you my bill 2 years ago. Here's a bill for $5,000. Are you going to pay it? Of course you're not going to pay it. So I think there's an aspect that still comes into the scenario and the conversation about what is reasonable, what is equitable, what is fair, not just billed charges.
Yeah. So let's talk about that in the context of deductible. So if somebody has a $5,000 deductible and they go into the hospital, and obviously they pay the first $5,000 out of pocket, the remainder is picked up by insurance. What's the advantage of going with a plan like yours where there is no deductible? What's the advantage to the hospital?
Yeah, cost to collect. I had a conversation with a CFO of a hospital once, and I asked that question. I said, how many $5,000 deductibles are you actually collecting from patients? And he actually had an answer, and he said it's about 17%. And I
Oh
said,
my
let me ask a
goodness.
follow-up. Let me ask a follow-up question. How many $5,000 deductibles do you collect from patients within 30 days of service? And he laughed and he said, I don't know, but I guarantee it ain't 17%. I said, yeah, so there's a cost to collect from that patient, 5 grand. We take that away. They do not have to chase debt. They don't have to turn their patients into collections. They don't have to set people up on payment plans. And, it's kind of like when you're selling your home, you don't want to own or finance it. Why, Craig? Because you want the equity in your pocket right then, so you can go put a down payment on a new house, right? Hospitals don't operate much different. They want cash flow. And so this is a solution that we're also improving accounts receivable, improving that metric, which is cost to collect from the patient, because that is a real metric that hospitals are very, very sensitive to. And if our plan steers volume to their hospital versus the competing hospital across the street, and we improve their accounts receivables, and we make them a little bit more equitable on, and they don't have to chase patients to collect deductibles and coinsurance. All of those things carry value to that hospital, and that's why they give me a lower rate. That's why they give me a better discount. That's why they negotiate a better contract. So that's what's in it for them. Increased volume, reduced cost to collect, better patient satisfaction scores. People actually like to come to their hospital now. So it does help. It's not 100% of the solution, but think about it. You're probably be in a little bit better mood, Craig, when you left the hospital, knowing you had a $0 deductible and out-of-pocket max versus whatever it was, 5,000, 6,000, 8,000. That's their skin in the game.
Now, people listening I mean, this is sounding really, really interesting. And I imagine there's a number of people listening. I'm even interested. If I came to you, would you be able to provide a health plan? Who do you cover? Who do you not?
Yeah, it's a great question. So right now, because everything is credit, you have to get the actual true payer. And when we talk about payers, I'm not, I can't take credit for this statement. I can't remember who it was that very first said it, but it's like calling H&R Block or calling Blue Cross Blue Shield or a Cigna or an Aetna the payers of healthcare is like calling H&R Block a payer of your taxes. H&R Block doesn't pay my taxes or your taxes or anybody else's taxes. Now, they may help administer and do the filings and get the forms all prepared and get your ducks in a row so that they can, and they may also submit it over to the IRS on your behalf. But the bill comes to Josh Butler and the bill comes to Craig Andrews. You're responsible for your taxes. So calling these big insurance companies payers is not accurate. So we work with the true payers who we believe are the true payers, which are employers and employees. Because think about how all healthcare is funded in this country. If you're privately insured, you're funding healthcare through premiums, or you work at a company that is self-insured or self-funded, paying those claims directly. If it's Medicare, that is through taxation. If it's Medicaid, that's through taxation. If it's all the taxpayers and the workers and the companies are the ones funding healthcare in this country. So we go work directly with payers. Our plan is a self-funded plan, and you can't be a self-funded individual, right? I mean, that's just, and I mean, you can be if you're Warren Buffett. If you're,
Right.
if you're independently wealthy, you don't need insurance. You just pay your medical bills as they come up. You pay cash for them. But the vast majority of Americans, as a matter of fact, 65% of this country still enters and accesses our healthcare system through an employer-sponsored health insurance plan. And so that's why our target audience is employers that either are large enough or have the ability to be self-funded. And that's what High Plains Health Plan targets, are those types of companies. That doesn't mean that we're not working to bring those solutions to smaller organizations, but it is not a fully insured product. It's a self-funded product because first you need to be in a vehicle. I tell people this all the time. Self-funding is just a vehicle. It's a vehicle that allows you to be in more control over what you spend in healthcare. And then you have to go take the opportunity of that flexibility and control, and you got to go negotiate better prices. And that's what we do for companies. And we show them ways to do it from primary care to acute care, all the way down to generic medication. across the entire healthcare spectrum. And if we're able to impact, the more we're able to impact every episode of care, the more we can save and the more that we can put back into benefits like $0 deductibles and copays, co-insurance, and things of that nature.
Very cool. Well, how should people reach you?
I'm all over LinkedIn. I've got a nice following there, and I can get a little controversial at times. But we all have our opinions, and we all have our ways that we see things and view the world, and especially this industry, because it impacts so many people. LinkedIn, I'm there. You can find me. Our website is butler-benefits.com. That's our firm's website. But we also have a dedicated website for High Plains Health Plan, which is hphealthplan.com. And there you can see we have a directory of people that we direct contract with, that's searchable just like any other provider directory would be. It gives some case studies there from some of our clients. And it really has a great call to action, because we believe, Craig, that what we're doing here in the Texas Panhandle, we know this. We don't just believe this, because there are people just like me and much more talented than I am all over the United States that are doing similar and same things in pockets of the country. And the hope and the mission is that this spreads far and wide, from market to market, city to city, because healthcare, it's cliche to say it, but healthcare is local. And when you can bring local and regional employers together with local and regional healthcare providers directly, and just negotiate terms directly with one another, you can really make a difference in the communities and lower cost for employees.
Well, excellent. Well, I wish you well in your mission. I think we need what you're doing. We need more people like you. And thank you for telling this story on Leaders and Legacies.
Craig, man, it's been a pleasure to meet you. I hope you're doing well, my friend. Let's stay in touch.